Welcome to the Jones Point Navigator Series podcast, where we bring together thought leaders and companies at the crossroads of healthcare, policy, markets, and innovation. Today's episode features Trey Sutton, CEO of Siftwell, a company that's leveraging AI to help community health plans deliver better care. We discussed how Siftwell's insights are improving outcomes, the important role of community health plans in our healthcare ecosystem, and why any sort of AI regulation needs to ensure that the tools are available to all players, regardless of size.
We start with their data sets, attach ours, and in this case, the question was, how do we get more people to cancer screenings? And in particular, breast cancer screenings for this use case. So we run the machine learning, spits out 12,000 members that need to go for a cancer screening. The machine then starts to move up into explainable AI, causal inference, and some other layers of our platform. And so you move from here, the 12,000 women that need to go, to here's a group of 250, 80% chance of non-compliance. And the reason that they're not likely to go is because they live more than 20 miles from a screening facility, don't have access to transportation, don't know it's a covered service and are price sensitive, and they need childcare when they go. And so what that does is it equips the plan with detailed or contextual enough information to activate those members to seek out health.
Welcome to the Jones Point Navigator Series podcast. Welcome, everyone, to the Jones Point Navigator Series podcast, where we bring together thought leaders and companies at the crossroads of markets, policy, and innovation. We're thrilled today to be joined by Trey Sutton, CEO of Siftwell. Trey, welcome to the Navigator Series podcast.
Awesome to be with you, Tommy.
Well, we always like to start with a segment called What's in a Name? I think naming stories are really interesting and a compelling part of building a brand, especially in the startup community. So we'd love to hear about how you came up with the name Siftwell and what it means for the brand and for your customers.
Yeah, absolutely, Tommy. So, what's interesting is we actually started as Periscope Health Analytics, and the idea there was, putting your Periscope up, seeing around, through, or above, kind of the noise and getting at what actually mattered. What we didn't want to do, though, is start the company with a lawsuit, and we quickly discovered McKinsey had a Periscope product, and so we backed off that. And we went about having a hard think and really collecting a lot of input on what we were up to and why it was important. And what we came up with was Siftwell. And what we do is we collect a lot of disparate data sources, bring those together, sift through that information using advanced machine learning, various forms of artificial intelligence, to make people well. And so it's about going through the data and it's about making people well with the use of that data. I think the really important part of it, though, is the well part, Tommy. I mean, when we think about what's important to health plans and what's important to us as former operators, it's really getting the results, it's really getting the outcomes. And so we talk internally about outcomes over insights, execution over exploration. And so I think the well is the more important part of the name. The logo also has a significant meaning for us. It's a Pegasus, and that was the creature that helped heroes achieve their mission. And so it's both the name and the logo that we spent some time thinking about before we went to market with that new brand. So
no, that's great. And I love the tie-in with the logo. And I think the well part is particularly interesting and salient, right? Because so much in healthcare is we need to focus more on making people better, not just prolonging things. So that's great. So I want to pull back a little bit. You kind of touched on it a little bit, but I'd love to kind of get a bit of intro on what you guys do, where you guys focus in healthcare, and kind of the key kind of product offering that you guys put out there in the marketplace.
Yeah, so I'll start with what we do, and then I can go into why we do it and some of the I'll use the term use cases here. So we start working with health plans, and what we do is we collect all the information that they'll make available to us. Foundationally, that starts with claims, so pharmacy claims, physical, behavioral health claims. But then we go deeper and we take everything else that they'll make available: call center data, customer satisfaction information, health risk assessments, where people live, where their providers are. And then what we do is we stitch that together with a bunch of data sets that we've built or sourced. And so think about access to transportation, social connectedness, employment. We know about kids being raised by single parents or grandparents. And so there's a lot of things that we pull together that serves as the data set that then we begin to explore using a series of different types of artificial intelligence. I think right now, when folks say AI, it's such a broad term. In fact, I'm up at AHIP this week, and there was a conversation going on about the dangers of AI, and referring to AI in such a broad term is almost like saying transportation is dangerous. And the danger profile that a motorcycle represents is far different than a Volvo station wagon, right? And I think it's important as we get deeper into discussions about AI and the potential of it, that we begin to peel apart the different types of AI in the applications, so as to not always conjure up kind of the evil robot notion of AI. Um, but I'm a little bit on a departure here, just about the safety of AI and the importance of it. But once we get that data set, we use machine learning to make predictions about who is going to progress in terms of their disease state, who is going to cost more money to the plan, but importantly, who's going to cost more money in terms of low value, no value, or avoidable costs. This isn't a cost play. This is about making members healthier and then potentially using those dollars to redeploy in other areas. Once we do kind of the risk work or the prediction work, Tommy, then we interrogate it. And what I mean by that is we move from the who to the why and the what to do about it. That's then presented to health plans, and we work alongside them to achieve the outcomes or results that they're trying to run. So let me bring it back down to earth with a crystal clear example, or a real example with one of our clients. We start with their data sets, attach ours, and in this case, the question was, how do we get more people to cancer screenings? And in particular, breast cancer screenings for this use case. So we run the machine learning, spits out 12,000 members that need to go for a cancer screening. The machine then starts to move up into explainable AI, causal inference, and some other layers of our platform. And so you move from here, the 12,000 women that need to go, to here's a group of 250, 80% chance of non-compliance. And the reason that they're not likely to go is because they live more than 20 miles from a screening facility, don't have access to transportation, don't know it's a covered service and are price sensitive, and they need childcare when they go. And so what that does is it equips the plan with detailed or contextual enough information to activate those members to seek out health. And then on the back end, we're also doing a little bit of psychographic modeling, Tommy, to distinguish those that a call campaign would be most suitable for. And then how do we work through community organizations for those that are less comfortable with that call campaign, or we can't activate them with that call campaign. So that's kind of the end to end of what we do. Now, there are other use cases, right? I mentioned progression of diseases, emerging cost, emerging unnecessary cost. We also work in the areas of risk adjustment. We work in the area of quality measure improvement. And then we also have got some more traditional marketing style use cases. So member retention, and how do you hold on to people, and so that you've got a longer time horizon to invest in their health.
That's great, and I appreciate you going from the high level down to a very detailed example. One thing you mentioned, actually two things you mentioned that I'd like to spend a little more time on, is that confluence of AI, but also the use of we'll call the social determinants of health in the data analytics. You've been in healthcare for a number of years, and the social determinants of health as a data point is relatively new. We'd love for you to talk more about how you, as a healthcare industry expert and an executive, have seen the use case and a positive use case of some of that transportation information, access to food scarcity, how that's helping drive better decisions and ultimately better outcomes across the healthcare system. But when combined with AI, I think it's a really interesting parallel to important, health policy trends.
Yeah, I completely agree. And, I mean, the recognition that these things are important, I think it's been around for a long time. I mean, what I'm really excited about is how it's being taken a lot more seriously from a policy perspective, and has been for a few years now. And funding is now being provided to health plans for those non-clinical, non-medical services that are really important to member health, like the ones that you mentioned: transportation, food, I think some of the other ones that are really important also, I mean, if you don't have a place to live, you're not going to worry about getting to an appointment, or you're not going to be worried necessarily about adhering to your pharmacy regime or whatever it is. And so, I think that it's been around, the notions have been around. I think the policy's catching up with the notions, and I think the funding is also. Being able to evaluate that information using some of the tools and artificial intelligence is super important. And the reason is because we will all agree all of those things are important for everybody. What we don't have is money enough to do all of those things. And when you get to certain areas of artificial intelligence, like causal inference and explainable AI, what you're able to do is really recognize what's the most important things for a group of individuals. And so, we'll agree that a behavioral health assessment, food access, transportation, motherhood, and apple pie, everybody should have it. But what we're able to do with the new technologies is align the individual with the most pressing needs based on their environment and their specifics. And what that allows you to do is really drive congruence between the availability of those resources with the exact individuals that need those in a prioritized fashion. Super important that we start to do that.
No, that's great. And again, I think as someone who lends more towards the techno optimist, I think we probably share that commonality. It's really exciting to get those positive use cases. Talking a bit about your market and the plans you work with. Obviously it's a big plan space out there across Medicare, Medicaid, and some other spaces. I'd love to hear, as you guys have built a company, where you've been focusing and where you found the most, kind of traction with the solution you guys have.
Yeah, thanks for that, Tommy. Yeah, I mean, I come from a public service family. Everybody on the team, it's really important that we all bring kind of a mission perspective to the organization. We want to do good in the universe, and this is our way of doing that, kind of in a small corner of the healthcare sector. And to be more specific, I mean, I come out of the community health plan space, was on the board of Association of Community Affiliated Plans. These are nonprofit plans or governmental or quasi-governmental plans. Generally, their boards represent their constituents or their members, so parents of members, county public health directors, county commissioners, and so we're really focused on kind of that, mission-oriented plans. I think AI can be used for evil, but a knife can be used to prepare a meal or harm somebody. I think about any tool or any advanced technology in a very similar way, and we're keen on working with folks that want to deploy these for the right reasons to truly improve member health. And so, that's super important to us, and that's the market that we're going after.
That's great. I think the community health plan is something that doesn't get the headlines of, say, the kind of the large Medicaid or Medicare Advantage plans. So let's talk a bit about working with community health plans. Some of the advantages and we'll say challenges of working with that space, which is, I think, when we're solving for the social determinants and things like that, obviously that relationship with the community is important. But I'd love to talk more about that market and your experience there and working with them.
Yeah. I mean, the thing is that, a lot of these plans have difficult times recruiting some of the talent that's available out there. I mean, I think in the healthcare industry, in general, there's just not a lot of data scientists with deep healthcare experience right now. And where they're going to the big firms. I mean, if you're a very capable data scientist, it's exciting to work for Google or OpenAI or, one of those Silicon Valley firms. If you're a health plan with, 100,000, 200,000, even 500,000 members, say in Wisconsin, it's very difficult to bring on the talent that's required to deploy some of these tools. It's difficult to afford them. It's difficult to find them and recruit them. And then once you do, it's not as simple as dropping an AI expert or a data scientist into your organization. You got to build an apparatus around it. And so, I mean, from having been the CEO of one of these plans, I can speak firsthand that, some of the things that I had hoped we could do, well, we just didn't have necessarily the resources to do it. And so, that I think comes with, is challenging for those plans, but we make such a perfect partner. We're able to bring our managed care experience, our focus on mission, and the talent required to deploy these technologies, all kind of in a seamless package for these plans. Resources are different, obviously, at a community health plan than, say, a United or a large national for-profit plan. That's not a criticism. It's just a different fundamental economic kind of paradigm, if you will. And so, I'm sure it would be great to get out there, sell big contracts to a few customers, and it would be super simple. That's not why we're in business. We're in business to truly help people, and so that requires us to go after more. The price tags are a little bit different, but we believe in the work that we're doing, and so those are some of the things that are on my mind regarding your question.
Got it. No, thanks so much. And just for background purposes, in the community health plan, the average beneficiaries, is there a kind of a typical, kind of income level, or does it kind of vary based on the plans?
Yeah, I mean, not to propagate any stereotypes about Medicaid, but that economics or income is definitely an eligibility requirement. Medicaid also covers folks with intellectual and developmental disabilities. We really focus on kind of the Medicaid, Medicare duals, meaning that they're eligible for both, or marketplace, kind of the individual marketplace plans. So all those can kind of be grouped under government-sponsored plans, and those are the ones that we tend to work with.
Got it. No, and I appreciate the sensitivity there, but I think given we have a large public payer across a lot of healthcare, and it's driven by income or age, I think it's appropriate. So no, and I just saw some interesting data this week that I think it's almost $800 billion spent in the Medicaid program, over 60% is through private Medicaid plans. So it's a pretty staggering kind of data, but also speaks to the amount of kind of opportunity out there for you guys.
Yeah, absolutely. And having seen fee for service, and then when I was CFO at Medicaid North Carolina, it was the majority of that spend, roughly 3 of the 14 billion was on fee for service spending. There could have been a couple other types of bundle payments, but the vast majority in North Carolina was fee for service. I think managed care is the step in the right direction. I'm eager to see what's next. When you capitate plans and it just becomes an intermediary for fee for service down the line, I don't think that's necessarily the right model. But I am encouraged by how many folks are talking about value-based payments and bundle payments and paying for value over volume. And I think what it's allowing us to do as a country is move from kind of paying for the number of procedures to paying for health. When I was at the department, that's always what I would say is, like, I don't mind paying for health. What I don't want to pay for is procedures or units billed or whatever it was. And so I think we're moving in the right direction as a country.
I agree. And I think that it's both, kind of better outcomes, better satisfaction. You see that a lot in some of the data and the incentives of Medicare Advantage, right? It's what is your patient or customer experience, as well as, what are the outcomes? So in a world where we're transitioning more and more to value-based care, and I totally agree, I think we're getting there. It's the U.S. healthcare system, so it takes a while. Let's talk a bit about how Siftwell helps plans and folks, with that transition to help, as we get to a more capitated world where you really have to, show the value and really help to improve outcomes and pair that with a better efficient use of that kind of premium dollar. Where do you guys fit into that? How do you help out and help plans achieve those goals?
Yeah. So, I mean, it's difficult to just describe it. When we usually get to this part of the conversation, there's visuals associated, but let me do my best, and then let's partner on kind of unwinding what I say to make sense for your audience. When we run our analytics, we do it on historic data sets, and what we look for is very stable patterns over time for small groups of individuals. And if you can imagine in your mind, almost seeing distribution curves for particular segments or pockets, micro segments within your population for the use case that we're talking about. So if we talk about individuals that are likely to be diagnosed with diabetes, CKD stage 1, something like that for the first time, we're able to understand not only the kind of the frequency of those diagnoses, but also the cost patterns of those individuals historically. If the plan or one of our point solution partners has the ability to impact that particular disease state in their geography, what we can actually demonstrate is the reduction in cost associated with engaging those individuals or deploying that program to those individuals. And then comparing it against very stable profiles historically or distribution curves, we can actually quantify the impact of that better approach to member care. So
that's great, and thanks for the real world example on the fly. I appreciate it.
yeah,
I want to pivot a bit and go back to some of the kind of big picture comments you made about AI. AI is a topic of conversation across every sector, and particularly in healthcare, there's a lot of focus on the good in this scenario. But as much as the industry is adopting AI technologies across the board, regulators and policymakers in DC are talking a lot about kind of what do we do here and how do we regulate. Would love your take as someone who's both in the weeds from a policy perspective as well as running a business about where you see the kind of guardrails for we'll call it a federal kind of AI policy. Obviously, there's state components as well. We can keep it simple, talk on the federal side here. Kind of things you like to see, objectives, and guardrails as someone who's kind of steeped in both the kind of plan world as well as in kind of the emerging AI use cases.
yeah, Tom, it's super important conversation that's going on right now. In fact, I mean, there's several conversations here in Baltimore, yesterday and today that are happening around this topic. I mean, I think we got to be really careful. I think that AI holds really great potential, but could also create great harm. I think we need to start getting more in the details about what we're talking about when we say AI, and then distinguishing between the development and the deployment of it as well. For us, if you're deploying it in low risk environments, for example, and Siftwell doesn't do this, but if you're talking about voice to text in a rural health clinic where folks are exhausted, you're experiencing workforce burnout, you're having trouble keeping folks because they're spending a lot of time on administrative things, that's an excellent area and holds great potential to deploy AI to kind of streamline or reduce administrative burnout or spend. Low risk, capture what was discussed, train it using lots of human involvement, and until you get it right, don't deploy it in full fashion. But once you do, really lean on it, leverage it. For Siftwell, we have all kinds of controls inside of the tools, the types of AI that we're using, prevent the propagation of certain biases. And then in the deployment of the tech, we're not doing medical decision making. So it's not see a surgical oncologist versus a radiologist. That's not the type of decision making that we're doing. We're more focused on proactive engagement of members, holding on to members, figuring out how best to engage them and meet them where they're at. So it's things like that we're doing, which I think presents a far lower risk profile for the use of some of these tools. All that being said, I do think that as we get deeper into this, that policy about the proper and ethical use of AI is going to be important. Sometimes when I'm talking to politicians or regulators about some of this, I hear reference back to social media. And, we wish we would have done a better job regulating some social media, because look what's happening now. I think that's I think that we just need to be very careful about the comparison between those two things. I think that social media can connect folks, and I think it's done a tremendous amount of harm as well. But I think that may be a false comparison when we're talking about AI. And I think it's really important that we get into the details and figure out where it can be safely deployed. And let's not hamstring people because the power is real. And we've got some macro demographics that are happening around an aging population, combined with the number of medical professionals moving in the opposite direction. And we're just not going to be able to meet that or close that gap unless we think about some of these solutions differently. Does that make sense, Tommy?
It does, it does. And the social media, comp uh, is interesting. It seems to me that a lot of the kind of positive use cases for social media would be like aspirational, whereas in the healthcare space, what you're driving is value, and hopefully that's a distinction that industry can make to people on the Hill, to people at HHS, to people at FDA, because of the outcomes, right? I think you'd like to hope that the influencer on Insta, that's great, the extra money in their pocket, but I think there's a big cost curve that hopefully I'd actually we'll pivot this into question. Is that a message that is helpful to people when you have those conversations? Like, no, we're actually helping bend the cost curve here with this technology. That's something that's as salient or resonates with folks, or is it still kind of too early to drill that down there?
No, I think you're exactly right. I do think that there's real value. And, I mean, Siftwell is not an AI company first. We're a healthcare company. The team collectively has held 12 C-level positions, either at Medicaid agencies or managed care organizations. And so we're kind of the brass tacks of maybe the AI companies out there. We're only interested in this technology insofar as it gets results and bends that cost curve or improves the health curve. And again, I think it's really important as we have this conversation, as folks are listening, this isn't about saving money. This is about identifying low value care, no value care, at the individual level or at the micro segmentation level. This isn't working for maybe this individual, or here's a higher value type approach, which I think is an important distinction. This is about making people healthier and having the ability to deploy financial resources elsewhere, to create more health elsewhere in your member portfolio. The other thing that I'm hoping that we get to cover a little bit, which is related to the policies, is just how the community health plans may be impacted by some of this, and so maybe we can circle back to that at some point in time.
Yeah, that was you're ahead of the game here. That's exactly what I want to talk about. I think you mentioned earlier there are some very large players in the space, and some that are in the news. But yeah, I think talking about that dynamic about that you see with the community health plans being impacted by some of these, kind of regulatory developments, I think is a great place to go. And candidly, one of the topics I really wanted to get to. So thank you for transitioning us.
Yeah, no, and I mean, here's where the motivation comes from, Tommy. Is I come from one of these plans. I think that the mission focused community health plans is a really important cornerstone of our health ecosystem in the United States. These are plans that are kind of tied to their communities, are responsible to their communities. I mean, I'll give you an example. I mean, the CEO of a large commercial insurance company is never going to answer the phone when a mom calls and is having trouble getting direct support workers to care for his or her autistic kid. That's just never going to happen. I think that large nationals play an important role in serving the vast majority of individuals eligible for Medicaid, kind of the mild to moderates. That's not to say that they can exclusively do that. I think the community health plans do an excellent job of that as well. But when you've got a governance structure that's tied back to the community and tied back to mission and not purely economics, what that allows for is a better focus on healthcare. What I worry about is as we get deeper into these conversations, that the community health plans may be priced out of the market in accessing the talent, the tools, and the other platforms that are available to them. How that could manifest, Tommy, is, when you think about how a Medicaid department or agency engages one of these managed care organizations, they do it by way of a formalized and public bid. So, Medicaid Agency of Texas puts out a bid. They say, hey, we want managed care organizations to take care of these populations. We're going to be awarding 4 or 5 of these things, whatever the number is. These health plans need to respond to those bids and talk about how good they are at managing populations and the tools, the people, everything else that they'll bring to the table to improve the health of eligible members in the geography that we're discussing. If they don't have access to the people, the tools, and technology then they're going to be outcompeted. When I think about AI in the future, this stuff's going to be like electricity. It's going to be everywhere. Everybody's going to be using it. Everybody's going to be relying on it. And I think when you talk about the kind of the disaster that is the U.S. healthcare system, if we don't start to lean on some of these technology, we're just not going to, I think things are going to continue to get worse. And so as folks are having conversation on the Hill and elsewhere, even at the state levels, we need to be mindful that this can't just be big tech doing this work, that these tools need to be accessible, at least within the healthcare industry, to plans that are smaller, which I think is important.
No, that's a great point, and I guess I'll ask you back. So, I think you're kind of touching on or getting close to the concept of we'll call it regulatory crowd out, regulatory capture. How do you ensure that as we build what is a needed, kind of regulatory paradigm here, that you don't get that crowd out, that it's accessible? Like what, if you had a magic wand or three wishes, to use an example, of ways to ensure that that is still democratized and accessible. Like how do you go about that? What's the best way to do it? Because you're making some great points about that community connection. I think that's, as you think about affecting some of those social determinants of health, it is going to be more about someone in your community who's responsive to you. So how do you make sure that those technologies are able to be deployed across, a wide range of actors for the most benefit?
Yeah, I mean, I think, Tommy, it's a really detailed answer, but let me maybe give some broad strokes on how I think about it. I mean, one, I think as we're approaching this, and I said it earlier, is we've got to get in the details. When we say AI, we mean 100 different things. There's AI to create job postings, AI to create marketing posts. There's kind of the ad hoc use of ChatGPT. There's things like revenue cycle management. How do you speed that up? How do you code things? There's voice to text. There's machine learning. There's correlational machine learning, which we have read about the risks of that in the newspapers. There's been some lawsuits about how that's being deployed in the area of utilization management and the propagation of biases. There's causal inference. There's explainable AI. And so I think peeling those things apart and talking about them in distinct part pieces is important. Then you kind of get into the conversations about what do you build into the box to prevent this stuff? What do you build into your processes? And then how do you continually monitor the deployment across the healthcare ecosphere, if you will? And so let's peel this thing apart. Let's not rush to anything. And I think if we approach it in a thoughtful, stepwise fashion, hopefully we'll get to where we need to get to, Tommy.
That's a great point. And it seems like there's, a lot of an educational component here that you've done a really good job of explaining, the different stratifications of risks and use cases and how each one might need their own, paradigm or process based on the use case and the impact. I think that's it. But I think you're right. There's a tremendous amount of educational work that has to be done within healthcare, right? We need to focus on what we focus on, and you and I both are steeped in healthcare, and that's probably an area for policymakers in the healthcare space to focus on before we think about other things. So that's great.
Go ahead. I was just going to say, I mean, I think the other great bit of news is there's folks that are taking this very seriously right now that are investing a lot of resources in it. I just worry about closed door conversations on the Hill with big tech, but I think that there's a lot of people that care about this and are doing good work in the space. So I'm optimistic.
That's good. No, I share your optimism about most things. So I think in conversation like this certainly will hope to broaden people's views of the applications and use case here. So let's talk about what's next. In February you guys announced a near $6 million round. Congratulations on that.
Thank you.
It's very exciting.
Yeah, thank you.
So talk to us. I'd love to hear more about that, and then kind of where you see you guys going the next kind of 12 to 24 months. Certainly exciting time for you guys.
Yeah, it really is, Tommy, and we're grateful for the partners that invested us. AliCorp led the round. They've got a great reputation in the team there. Bill Georges and Brenton, Kevin Ryan, the awesome team there. And then Arc in Digital Health, we're working with Nadav Shimoni there. Again, he's a physician, absolutely committed to the kind of the mission components of this. So we're excited to have those two, and then Tao followed as well. And so grateful for those partners to put a little gas in the tank. I think as I think about Siftwell and the future of Siftwell, I mean, we want to improve the lives of 100 million Americans' health. And that's not the denominator, that's the numerator, Tom. I mean, like, we really want to touch 100 million Americans and improve their health. That's the overarching goal. As I think about the more near term, we got to build out the product more. We got more use cases. We got more and more ways that we can improve member health. We've got to get it in more people's hands. And we've got to make sure that when it gets in their hands, that the results that they're hoping for are achieved. And so, we're expanding our partnership team a bit. We're expanding to how we think about customer success. And to put it shortly, customer success doesn't equal contract expansion, which I think customer success means for a lot of potential SaaS companies. But we really think about what are the plans, objectives, what is the executive that we're working with, exact annual goals, and how do we serve as a partner to doing that? And then product, we got to build out the product. We're excited about what the underlying flexible technology is doing currently, but I think there's a lot more areas, a lot more disease states, a lot more quality measures that we can begin building and branching out into. So those are the big ones for us right now, Tommy.
That is certainly a big menu, but based on our conversation and some of the stuff you guys are doing, it's an exciting time, and I'm excited to watch you guys kind of take that jet fuel and continue to grow, because there's so much opportunity out there. And again, the way your vision for the company and where you guys want to take this technology is truly inspirational, and it'll be exciting to watch. So Trey, thank you again for joining us on the Navigator Series podcast, and we look forward to keeping in touch.
Awesome. Great to see you, Tommy. Take care.